listening to the Sickle Cell Action Network, a weekly internet radio show presented by Martin Center Sickle Cell Initiative and sponsored by Mast Therapeutics. We're coming to you live from Indianapolis, Indiana. We're here to serve you by providing up-to-date information and opinion on all matters pertaining to sickle cell disease. My name is Gary A. Gibson, and I am your host for the next 2 hours. Let me start by saying that I don't have sickle cell disease, nor do I carry the sickle cell trait. In spite of that, I am no stranger to sickle cell. Quite the contrary. You see, even though I don't have sickle cell, it has had a very huge impact on my life. That's true because its complications took my wife from me after 12 years of marriage. It also caused her to have a miscarriage that resulted in the loss of our twin babies that she was carrying while in a sickle cell crisis. So all told, sickle cell has taken 3 lives from me, and I feel the pain of those losses every single day. I currently serve as the president and CEO of Martin Center Sickle Cell Initiative, a community-based organization that has been serving people with sickle cell for over 45 years. Each day, I attempt to transform the pain of my losses into positive energy that is focused on making a difference for those who are battling sickle cell. From being involved with sickle cell for over 40 years, I'm able to say that much progress has been made, but there is still so much work to do. The show is an opportunity to contribute to the ever-expanding dialogue about sickle cell that is taking place all around the world. Our show is about raising awareness, but it is also about so much more. I like to say that sickle cell awareness is important, but we need more than awareness. Those living with sickle cell are already aware. That makes me ask, so what are we doing for them? My answer is, not enough. That's why we've named this show the Sickle Cell Action Network, because awareness without action has very little impact. We want this show to be a source of information and a call to action to help those who must live with sickle cell in their midst. We've designed the show to provide information that is beneficial to patients, caregivers, family members, and friends alike. Most importantly, we want people with sickle cell to know and understand that they are not alone. The Sickle Cell Action Network show features live guests who are healthcare providers, patients, advocates, and others who are engaged in the fight to eradicate sickle cell and ease its burden on those it affects. Today, we're pleased to have 3 very special guests who will speak with us about the nurse's perspective. Joining me today in studio are 3 nursing professionals, all with different connections to sickle cell disease. My guests are Jennifer Karracher, Jade Parker, and Victoria Davis. We're very happy to have all 3 of them here with us today. Before we get to today's topic, however, I want to share some of our upcoming topics with you so that you'll know what we're going to be doing. In future weeks, we will cover such topics as aging gracefully with sickle cell's narcotics dilemma, traveling with sickle cell, and many others. So as you can see, we are serious about sharing valuable information, and we hope that you will join us every week, same time, same station. If you've missed some of our previous editions or wish that you could listen to them again, don't worry. Just go to the Martin Center Sickle Cell Initiative YouTube page, and you'll find them there. Now let's get on with our show, and we'll start with this week's edition of Sickle Cell News Update. Selected 3 different articles, I think, of importance that I would like to share with you today. And the first is titled, Management of Care Transitions for Emerging Adults with Sickle Cell Disease. And this is about a notice of an upcoming PCORI funding announcement. PCORI stands for Patient-Centered Outcomes Research Institute. And PCORI has announced the availability of funding for a new study. An official announcement will be released by PCORI on August 15, 2016. PCORI will be seeking proposals from teams with expertise in patient-centered comparative effectiveness research, focusing on care transitions for emerging adults ages 16 to 25 years of age with sickle cell disease. The transition in care from a pediatric to an adult setting for emerging adults with sickle cell disease is a life-changing event with a high risk of care discontinuity. While care for pediatric sickle cell patients is generally well managed, the transition to adult care can lead to a decrease in quality of care, a breakdown in care coordination, and potential disengagement of individuals with sickle cell from the healthcare system to the detriment of their health and well-being. PCORI seeks to fill current evidence gaps about how to improve the care transition process and patient-centered and clinical outcomes for emerging adults with sickle cell disease. Current guidelines are based on weak evidence and/or consensus-based opinion. PCORI is seeking to fund up to 3 cluster randomized controlled trials which will compare the effectiveness of established transition coordination models for emerging adults with sickle cell disease transitioning from pediatric to adult care. The research is expected to examine direct comparisons of efficacious or commonly used transition coordination models or interventions. Interventions are required to demonstrate robust engagement of patients, caregivers, clinicians, and other key stakeholders. Interventions should incorporate patient-centered strategies within a health system setting. Note that this funding program does not support applications to conduct cost-effectiveness analysis, systematic reviews, or development and evaluation of shared decision-making or decision support tools. Proposed studies should address the priority research question identified in the main body of the announcement. This pre-announcement of the PFA is provided to allow potential applicants additional time to identify collaborators, obtain stakeholder input on the research question, and develop responsive, high-quality proposals. We are very excited about this particular effort, and we are hoping that it yields some positive results, because one of our biggest outstanding issues in the world of sickle cell is the transition of care from pediatrics to adult care. So that study can help that process in the future. Second story today, quite interesting. This one is titled, "No Sickle Cell Screening, No Wedding." And the article reads, the governor of Anambra State in southeastern Nigeria, Willie Obiano, has said intending couples in the state who fail to screen for sickle cell syndrome before formalizing their marriages would be punished. I guess intending couples in Africa is what we would call engaged couples. He said such violators would be denied certain privileges from the state government. To ensure that intending couples go for the test, the governor stated that his administration would partner with churches in the state to enforce the order. The governor, who spoke through his commissioner for health, Dr. Joe Akabuiki, at a ceremony to mark this year's Sickle Cell Day in Aka, said it was part of the state government's determination to eradicate sickle cell disease. Obiano noted that churches would play a major role in the fight against the medical condition because of their involvement when couples want to get married. The governor added that his administration would implement to the letter the sickle cell law passed by the State House of Assembly in 2002, which made it mandatory for intending couples to verify their genotype before marriage. He stated that involving the churches would ensure strict compliance to the law, adding that the state government would set up sickle cell clinics in 3 senatorial districts of the state with state-of-the-art facilities. Obiano explained that people living with sickle cell disorder in the state would be treated without charge under a health insurance scheme that would be launched in the state. He said, in the health insurance scheme, there is also a provision for free of charge medical treatment for the vulnerable, including people living with sickle cell disorder, as our main target is to eradicate sickle cell anemia completely in this state, and that is why we are urging everyone to know his or her genotype. That's a very interesting story. We talk quite a bit about people knowing their sickle cell status prior to conceiving children, and apparently in Nigeria, at least in Anbar State, they're taking that really seriously. So I'm not sure what people will think about that, but it's definitely a move that will have repercussions. Good, hopefully. And our final story for today is a story about Sickle Cell Partnership creating demonstration project to treat children in Angola. And I like this story too. The Angola Sickle Cell Initiative, a public-private partnership of the Angola Ministry of Health, the Baylor College of Medicine International Pediatric AIDS Initiative, Texas Children's Hospital, and Chevron, is teaming up with the global biopharmaceutical company Bristol Myers Squibb to provide children with sickle cell disease in Angola with an effective medication to which many patients in the country have lacked access. The program will provide thousands of Angolan children regular access to hydroxyurea. This new 5-year demonstration program is intended to build understanding of the effectiveness of treating children in resource-limited settings and to establish the cost benefits to the healthcare system. World Sickle Cell Day was June 19th, so this is a momentous time to announce this new partnership to provide potentially life-altering medication to thousands of children in Angola, one of Africa's hardest hit by sickle cell disease, said Dr. David Poplack, director of the Texas Children's Cancer and Hematology Centers and professor of pediatric oncology at Baylor College of Medicine. Hydroxyurea is known to lessen the devastating complications of sickle cell disease, he said. Angola has one of the world's highest rates of the genetic blood condition, with up to 10,000 babies born with the disease each year. By some estimates, up to 50% of these children die before 5 years of age. However, most patients in the country have not had access to hydroxyurea. Bristol Myers Squibb will donate hydroxyurea for the treatment of up to 1,200 children during the first 2 years of the program, increasing this up to 4,100 after the pilot period. The program will launch in Luanda and Cabinda and later will expand to additional sites. Last year, Bristol Myers Squibb made an additional donation of hydroxyurea to the Sickle Cell Initiative of Angola. So again, another good story. You got a really strong collaboration of the Angola Sickle Cell Initiative, the Angola Ministry of Health, the Baylor College of Medicine, Texas Children's Hospital, and Chevron teaming up with Bristol Myers Squibb, all trying to make an impact on sickle cell disease in the country of Angola. We really, really think that's great. And finally, I'd like to close this section with a reminder that registration is now open for the 2016 Annual Sickle Cell Patient and Family Educational Symposium in Los Angeles, California, from July 28th to July 31st. This convention is the only conference in the sickle cell community that is solely focused on people living with sickle cell disease, their loved ones, caregivers, advocates, and caring health professionals. The conference will have programs that focus on the entire lifespan of those with sickle cell disease, encouraging you to live, survive, and thrive. The convention website says that sickle cell warriors are not victims to be pitied. We are warriors who collectively are in a fight for our very lives. Only someone who deals with sickle cell disease can understand what you are going through. So come join us, be celebrated, educated, and empowered. Yours truly will be giving the keynote speech at the awards banquet on July 30th. I'm looking forward to seeing everyone there. To learn more, please visit www.sicklecellconvention.com. It's a pretty cool website too, by the way. That's www.sicklecellconvention.com. And that's it for this edition of the Sickle Cell News Update. When we return, we'll start our discussion about sickle cell disease, the nurse's perspective, with three very outstanding nurses. This is the Sickle Cell Action Network. I'm Gary A. Gibson, your host. Action Network right here on RadioNext.tv, the Cool Groove site. I'm really happy to have three dynamic nurses with us today. And I'm also excited to say this is actually show number 40. It's hard to believe that we have done 40 shows for the Sickle Cell Action Network, but thanks to the support of everyone out there, thanks to the support of Mass Therapeutics, thanks to the support of Martin Center Sickle Cell Initiative, and all of the many guests that we've had this whole time, we have reached a milestone of 40 shows, and really happy about that. So let's get you acquainted with our guests today. I'm going to go left to right from where I'm sitting, and to my left immediately is Jade Parker. Jade, you were on the show once before and you did such a great job. We thought you should come back, so you're back. And you're coming back with a totally different topic, and this one I think might be quite interesting. So Jade Parker is with us, and also Jenny Carricher, who is with us. Jenny is a nurse or a nurse practitioner at Riley Hospital for Children. It's also her second appearance on the show. Jenny, you did a great job also. That's why you're back. So thank you for coming back, and thank you for what you do every day to help kids with sickle cell.
Thank you.
And also, last but not least, is Victoria Davis. And Victoria is actually relatively new to the sickle cell scene. She is a nurse, but actually started working with us at Martin Center Sickle Cell Initiative in the planning of our 2016 Indiana Sickle Cell Conference. Did such a tremendous job in working with us and helped create one of the most successful parts of our conference, which is a role-play skit that we put on for the doctors that were in attendance to tell them what it was like from the patient's point of view to go to the emergency room. From that point, Victoria also jumped in and helped and participated in our walk committee. So as a person who doesn't have sickle cell and who doesn't really treat people as standard practice for sickle cell, but who is working with sickle cell, welcome Victoria Davis.
Thank you.
All right, so always what we do, for those of you that have been here before, Jade and Jenny, I always want you to tell people a little bit about yourself so they can know who they're listening to. So we'll start with you, Jade. Actually, we'll start with you, Jenny. Let's start by you telling us a little bit about yourself. Tell us, where were you born and how and why did you get into nursing?
Well, I was born in Goshen, Indiana. That is a small little city up in the northern part of Indiana, near Elkhart.
Right.
So I actually started out in music when I went to college.
Really?
Yeah, I had a music scholarship to Ball State.
Okay.
And started there in cello performance.
Okay. Cello?
Cello,
okay.
Yes. Once I realized that it would be very difficult to make a living being a professional musician, I switched to music education. That was right about when they started closing down music programs across the country. And I had to do some soul searching. I had always thought about getting into medicine. I can remember back to second grade talking about how I wanted to be a pediatrician. But 3.5 years into college and changing majors and trying to go to medical school at that point would have been a nightmare. So I looked into nursing as an option and just kind of jumped in feet first and went for it.
Awesome. Do you still play cello?
I own a cello. I haven't played in a while.
Okay, cool. That's a fact. I've known you for a while, and that's a fact I didn't know. Interesting. Jade, same question for you. Please tell us about yourself. Where were you born, and how and why did you become a nurse?
I was born and raised here in Indianapolis, Indiana, from a single-parent household, and I received a lot of care for sickle cell treatment initially at Riley Hospital.
Okay.
So that was my first place of exposure to the healthcare field. And I remember as a young child, being hospitalized a few times a year, just in and out of the hospital and taking weeks at a time off from school. And so you kind of want to make something your home away from home. If you have no choice, you have no option to be at home. And so with me constantly being in the hospital and getting acquainted with other healthcare professionals, the doctors and the nurses, I more so started to lean towards the nurses because those were the people that I was spending the most time with, and those were the people that I could directly see were giving me direct patient care. And from there, I just had this wild thought in my head that, I enjoyed the care and the facilitation of how they helped me heal and get through those crises and those episodes of excruciating pain as a child. And I had a wild thought that maybe I can do this too. Mm-hmm. And so I was always told that, hey, Jade, you're so smart, you can be a doctor. And I was like, I think I want to be a nurse because those were the people that I related to the most. So I went off to school. I went to a 4-year university, which was a little challenging with having sickle cell, with dealing with that condition. And I became a nurse. So now I'm a bachelor certified registered nurse, and I'm currently working in rehabilitation hospital, but I am looking to merge my patient perspective that I have with dealing with sickle cell and pair that with my now nursing and healthcare background that I have now. So that's my purpose. That's I feel my mission is.
Victoria, how about you? Your turn now. Tell us a little bit about yourself. Where were you born, and how did you get into nursing?
Well, I was actually born here in Indianapolis, Indiana, at the very hospital that I currently work at now, Methodist Hospital. But I was not raised here. I was raised in Decatur, Illinois.
Okay.
And so that's where I was born here in Indianapolis.
Okay.
And I kind of got started with nursing. It was not my first career at all. I wanted to either be a lawyer or a certified public accountant.
Oh, really?
So I was kind of guided down this path. I took Accounting 101 and decided too many numbers for me. As far as a lawyer, I actually had a mentor, but I just was looking at how long it would take me to become a lawyer. So I started out being a CNA, did that for a couple years, went to school to be an LPN, graduated in 1998, and then I moved here in 2001 and graduated from Ivy Tech school in 2005 as a registered nurse.
Okay.
And I recently graduated with my master's from University of Indianapolis this past May.
Awesome. Well, thank all three of you for being here today, and thank you for sharing the stories of how you got into nursing. Jenny, would you take a moment or two to share your personal philosophy about nursing? What I mean is, what does nursing mean to you, and what makes a good nurse?
Well, for me, being a nurse means taking care of the whole person. The mind, the body, the spirit, and making sure to also take care of their family as well. As a nurse, I always want to treat someone as if they were a member of my family. So if I would be satisfied with my mom or my brothers receiving the type of care that I'm giving, then I know that I'm giving great care, and I know that I'm being a good nurse. So that's how I view nursing and what I think makes a good nurse.
Okay, and then Victoria, what about you? What's your personal philosophy?
I agree totally with Jenny. And I also believe being respectful of others, their beliefs, because we in the healthcare system, we see a lot of different religions. So we also have to be mindful of what their beliefs are and being respectful of that. And also what does quality of life means to them, because what we may feel is best for them is not always their interpretation of the health care that they will want to receive. And also making sure that you include them in the decision-making process, or at least a representative who is speaking for them on their behalf. We have to be very respectful in regards to that.
Okay. And Jade, what about you? What's your personal philosophy on nursing?
My personal philosophy on nursing, with being a patient and having that perspective first, is being present for someone in regards to their mind, body, their spirit, their whole being, as Jenny has said. I'll piggyback off of that, and realizing that everyone has a story, and a lot of times people do not choose to feel ill or to deal with a disease or something that makes them not feel well. So understanding that when people come to us and I have to treat someone, that they are vulnerable, that they need someone that is going to understand them and being compassionate for them. And with me being a patient, first and foremost, I always like to think that my success and what makes a good nurse is what the patients say. I can say on my own accord that I'm a good nurse, but if the people that I'm providing care for and their families don't believe so, then that I don't believe that would be true. So
right.
That's what I base my success off of, and making sure that I treat someone just as if I was presenting to the hospital and needing care as well.
Okay. Thank you all for your answers to that question. It is time for us to take a break, and when we return, we'll continue our discussion about nursing, and we'll get a little deeper into it. This is the Sickle Cell Action Network, right here on Radio.
Fast Therapeutics is leading the way in developing treatments for sickle cell disease. We're proud to sponsor the Martin Center Sickle Cell Initiative in its mission to provide leadership, education, and support services to the sickle cell community.
Welcome back to the Sickle Cell Action Network. I'm Gary A. Gibson, your host, and we are having a discussion about nursing and sickle cell from 3 different angles. We're calling this show The Nursing Perspective. And we actually already talked with our 3 guests about how they got into nursing. And the next thing I want to know from each of them is, did you encounter any kind of challenges that might have kept you from becoming a nurse? So, Jenny, did you?
I think the biggest challenge for me was simply changing my major so late in the game. I had
Okay.
already been in college for 3.5 years. At about 5.5 years, I still had quite a bit of schooling left and was running out of financial means in which to complete my degree.
That's always a challenge.
Yes, so I had to leave Ball State, move home
Okay.
in my early to mid-20s,
Okay.
and change to IU South Bend and finish my degree there.
Okay.
So by the end of it all, it was 8 years for a bachelor's degree.
Wow. Okay. That's a challenge.
It was
But
a
you
big
got through it.
challenge, but I did get through it, yes.
And congratulations on that.
Thank you.
Jade, what about you? Obviously, sickle cell might have had something to say about trying to keep you from being a nurse. Did anything else get in the way?
I would say I attended a historically black college, university, Kentucky State University in Frankfort, Kentucky, and one of the issues that I was having internally was having people that I was very excited about going there, and people that looked like me and could possibly relate to the background that I came in from, and having those same people that I thought I was going to relate to tell me themselves that I wouldn't be able to do it, based on the curriculum and how long it usually takes for people that they have known to get through the program. And so with me being a traditional student and being young, I got into the program my sophomore year when I was 19, having to really know myself in a sense and know when to separate myself from my peers. And so it became a daily and weekly decision to, you're serious about this. You came from a single parent household that cannot support you financially through college, so you better not come home with nothing.
Right.
There's so many people that invested in me, and so I didn't want to let those people down, including my mom. And so I just had to get through it. And so I graduated from the Associate Degree of Nursing program. That was 2012, and I graduated with my BSN in 2014, and the rest has just been moving. But
Well, Jade, those people that told you maybe you couldn't do it, they didn't know you, did they?
no, they didn't. And
tell
some
me
of those
that,
same people, after I had gotten into the program and they saw that I was, getting through to the next semester and next semester, other people were applying, and then it became a thing of, oh, can you help me? And what do you think about this professor, and what's their style of teaching like, and what do I need to look for? And it's like, oh, but you said I wouldn't get into it, or let alone graduate, or make it through the first semester.
There's another thing about you that you didn't mention that you have told me about previously, that another obstacle that you encountered, if I'm not mistaken, something like a bad car accident.
Yes. Wow. This was right before I was getting ready to graduate
Right.
with my RN to sit for boards to take the registered nursing licensure exam. And it was February when I was getting ready to go through those classes that prep you to take the exam so that you're prepared once you actually sit down for it. And I was actually leaving nursing clinicals in Louisville, carpooling with my classmates, and I was sitting in the back seat of a four-door sedan, and the traffic was stopped on the highway, and a Ford F-150 rear-ended us at 65 miles an hour. So the car was totaled, and I was hurt the worst since I was in the back. My seat actually ended up right behind the passenger seat. It just was like a squished little box, and there actually, I questioned whether at that point afterwards, coming back and waking up out of that, because I don't remember the accident, I was like, oh my gosh, like, I don't even know if I'll be able to take care of myself. Like, forget being a nurse.
Right.
I don't know if I'm gonna like have a thriving livelihood now. And I was 21. And so I had learned a few months afterwards. I was talking with a friend that had also been in the car accident. She was sitting in the passenger seat up front, and she was saying that a nurse had stopped on the highway, and because traffic was backed up and everything at that point, and the car was pushed out of traffic, and she was trying to get into the car, so I'm out of it. I'm knocked unconscious, and the other two girls that were in the car with me, they're like, hey, what are you doing? Because they don't know this lady. And she said, no, it's okay. I'm a nurse. I will stay with you all until the ambulance comes. And it took that being said to me to know that, okay, I was spared for a reason. And I knew that it wasn't going to be an easy task recovering from that, but I made a full recovery due to, first and foremost, that nurse stopping to help.
Right.
Right. She didn't have to do that, but she did. Right. And so I just remember how caring of a person I knew I was, and how I wanted to be a nurturer like that. And it really tested my beliefs. It tested my strength. And so after that, it definitely was a struggle. I had some speech issues. I had some cognitive deficits, but I had psych therapy for a little bit. I was seeing a psychologist, and mostly really the prayers from everyone that I received, I believe, is what healed me. And so I think that's a major part of nursing.
I hope that you don't mind that I brought that up.
No,
but
I totally forgot.
I think it's important because it shows your strength.
Yeah.
And the fact that you were almost ready to graduate, and you were in that situation, and you fought through that on top of everything else you fought through all the years preceding.
Yeah.
It just shows how strong of an individual you are. And I really wanted our audience to know that there is this strong person sitting in this room with us. So thank you, Jade.
Thank you.
And what about you, Victoria? What kind of obstacles? Hopefully you didn't have any car accidents or anything getting in your way.
No, I didn't. And Jade, I think that's something, if it doesn't bring back too many memories, that you should, always share that story, because you just never know what your story can help the next person.
Yes, I agree.
I was not in any car accident, anything like that, but I was a single parent, so that was very challenging for me, but I had great support. So without the support from my family and friends, I know the journey to nursing would have been a little bit harder. Excuse me. Nursing is hard. I tell all the new nurses that's coming in, nursing is not easy. You go through all the emotional challenges, the stress, the
We're
physical.
We'll talk to you about that a little bit later. Yeah.
Yeah. So it's just it's hard, but it's a rewarding career as well. Yeah.
Okay. Well, Jenny, I'm coming back to you now, and I'm going to ask you, because you work at Riley Hospital for Children, you're positioned to treat and care for infants, toddlers, and teenagers. As a result, you can observe how sickle cell affects them as they age. What's that like for you?
Well, I think it affects me differently depending on the type of patient that I'm taking care of.
Okay, could you please explain?
Some of the kiddos that I take care of have very mild disease.
Okay.
So as I watch them grow and get older, they might deal with mild issues here and there, but primarily they're just dealing with normal childhood issues as they get older.
Okay.
For the patients that have more severe disease, it's very difficult to watch them. As infants, if they have a pain crisis, and then as they get older and they have more severe pain, longer pain crises, maybe more frequent pain crises, that gets very difficult.
Right.
As children get older, you start to see more target sites develop, which are like repeated areas. You start to see complications like avascular necrosis. That gets hard, especially when you have a 10-year-old walking down the hallway and he's limping and can barely get by because his sickle cell is so severe that he's barely mobile.
Walking like somebody that's 65 and needs a new hip. Yeah.
Exactly. I have 10-year-olds that need new hips.
Yeah.
So if a patient's more affected by their sickle cell disease as far as being sick, being in lots of pain, having lots of complications, it affects all of the aspects of their life. It hits their social life, it hits their school life, it affects their ability to learn, especially if they've had a stroke or if they're in the hospital all the time because of frequent complications. So that's all very difficult for me to watch. The longer that I am working as a nurse practitioner, seeing the same kids come and go in and out of the office, the more that relationship develops, the closer you get to that patient.
Right.
And they
then that makes it harder.
Aren't just a patient. They are a person. They are somebody that I know and care about.
Thank you.
You're welcome.
Thank you. Jade, obviously each of you here want to help people get better, but I wonder, do you think that your perspective as a nurse who just happens to have sickle cell disease might be a bit different from Jenny's and Victoria's perspective? If so, why?
I feel it may be a little bit different. There's a thing where, people say, oh, I know how you feel. I know exactly what you're going through. And realistically and honestly, I can't say that a doctor that comes in and tells me they know how I feel and they know the pain that I've felt or that I'm experiencing that moment genuinely knows. You don't really have the closer you are to experiencing something, the more you have an understanding of it. And so I think I bring to the table the fact that I do know what that pain is like. I don't see a lot of sickle cell patients in physical rehab, but I have seen a few. I have seen a few young black people that look like me, and that I very closely relate to. It just may be the fact that I'm not having pain that day, or I'm not having pain as bad as they are. And so I think it allows me to gauge pain a little bit better, to determine that, even though I know that pain is subjective. All nurses know that.
Let's talk about that. Is it really?
I do believe that pain is subjective. People choose to show how much pain they have differently. People respond to the pain that they have differently. I know when I'm in a great deal of pain, a lot of times I may not be very tearful or crying until I just feel like this pain that's in my leg makes me feel like my leg is going to fall off. Until I have pain more often than the average healthy normal person that does not deal with sickle cell. I like to think that I don't have a lot of pain because I don't have pain every day, but I do have chronic pain at times. And so dealing with that, it becomes the norm for me. And so you're not as excited by something that occurs over and over and over again. So when I have pain, it's just kind of like, oh, this is annoying. And then when you get to the point where you're ready to present to the ER, then it's like, oh my God, please help me. I feel like I'm dying. And so a lot of people that don't experience that on a daily or chronic basis, they don't know how to respond to that. And so the smallest pain or the smallest uncomfortability may put them in a place where they feel like, oh my gosh, I just can't take it, because it's a stimulus that they're not used to.
Okay. And Victoria, you don't specialize in taking care of people with sickle cell like Jenny does, and you don't have sickle cell disease like Jade does. In spite of that, we invited you on the show because, as I said earlier, you've been volunteering with Martin Center Sickle Cell Initiative, and through the activity that you've done with us, you've come to know a lot more about sickle cell. Would you please share your impressions about what you've seen and heard about sickle cell since you have started working with us?
So far, I know that what you do in the community is a great support system. A lot of things that I didn't know regarding sickle cell, I found out during the annual sickle cell conference, which was very informative. That was held in April. because in nursing school they don't go into depth in regards to sickle cell. They just kind of give you a basic overview, but as far as like all of the different types of sickle cell that's out there, we wasn't taught that. So, and I don't know why.
And it should be different though, shouldn't it?
It should be. I think it needs to be a little bit more information shared with the nursing students regarding sickle cell patients and the different types of diseases that are out there, as well as the complications from them. And also the myths that are still out there in the community, because recently my mother, she came to me, she called me because she takes care of elderly out in the community, and she stated that one lady told her that sickle cell, it only affects black people. And so I told her, no, that is a myth. That is not true. I said it's primarily in the African American community, but it also happens in all races. So knowing that there still is that myth that's out there, that a lot of people don't understand sickle cell, but just keep putting the education out there, just letting people know about sickle cell. That's the only way that we're going to be able to correct some of those myths.
Jenny, when you were going through nursing school, did you get much information on sickle cell?
No, not really.
Yeah. What about you, Jade?
We covered a little bit as far as textbook, but I made sure that
you added your
that definitely was pushed in there, and I tried to make a good majority, if not all, of the projects that I had that were on my own doing, not group projects. I pushed it there too, but my own personal projects that I had for class, always trying to make sure that I incorporated that, because this is my life and it's helping me learn, and I would hope that my approach and the exposure and breaking some of those myths would show to my peers. And so a lot of times they'd be like, oh, well, I thought that you have to look like this, and well, you don't look sick. Well, what does sickle cell look like?
Right.
Because you're looking at it right here. So
those people that were in the classes with you probably got more exposure to sickle cell than those in other nursing classes.
And they told me that they were thankful. So I'm glad about that.
This is one of the things that we kind of hope that will change in time, is that doctors and nurses both get more exposure to sickle cell when they're going through their respective schoolings. We're going to take a break, and then when we come back, we'll continue our discussion with Jenny Carricher, Jade Parker, and Victoria Davis, and we're talking about the nurse's perspective on sickle cell. This is the Sickle Cell Action Network, and I'm Gary A. Gibson, your host.
Hi, I'm Gary A. Gibson, your host for the Sickle Cell Action Network Internet Radio Show. If you are impacted by sickle cell disease in any way, whether you are a patient, a caregiver, or a friend, you need to join me every Tuesday at 4 p.m. Eastern Time. I promise that you will find our show to be full of information, perspective, and opinion about all things sickle cell. See you Tuesday right here on RadioNext.tv, the Cool Groove site.
Welcome back to the Sickle Cell Action Network. I'm Gary A. Gibson, your host, and I'm having a great time really enjoying this discussion with these three outstanding nurses that are here with us today. We've covered a lot of territory already, and we still have some other things I'd like to ask them about. So I'm going to go to Jenny now. And Jenny, I imagine that all three of you see patients of all kinds suffering in pain. Please tell us how, and you sort of touched on this earlier, as you talked about getting closer and closer to the patients you see over and over again. Please tell us how you're able to keep a level head when you're subjected to seeing so much suffering over and over again.
I just simply try to focus on doing what I can to help my patients feel better. Physically, mentally, spiritually, emotionally, knowing that what I'm doing, even if it's something small, might be helping them work through the suffering that they're experiencing. So knowing that I'm helping, even if it's a little bit of help, that helps me to kind of keep a level head and deal with all of the pain and suffering that I see on a daily basis.
Yeah, on a daily basis. And then when you get home and you don't have the reinforcement of knowing you're doing something right then, does it still creep in?
It can, yeah. If I've had an especially rough day, a difficult case, something that perplexes me, something that I can't quite figure out, yeah, that's hard. It's very easy to take it home.
Yeah. Victoria, what about you? How do you stay composed?
When you know there's nothing that you can do for a patient that's having pain, and you actually is seeing them, that's a very difficult thing to see. I always try to advocate for the patient. I'm the one that's in the room, have the most closest relationship with the patient. Just speaking to that doctor, listening to the patient, providing that emotional support, and then also just trying to think of some type of preventative care. What could have been done to prevent this much suffering if it was able to be stopped? So just listening to the patient, just really being there for them, advocating for them, that's a huge thing to do.
Okay, and Jade, as someone who knows pain all too well, what's it like for you to see others in pain?
I hate it. It's not only physically draining, it drains your emotions. It, and in a sense, can weaken your spirit. And you need that to fight. You have to have a strong spirit to fight, and to continue to go on, and to have hope that things will get better, even though in that moment that things are terribly wrong because you're in a lot of pain. And so I pray that I have empathy, and that I can use that empathy to be comforting, whether it's allowing someone to vent and understanding where they're coming from, and then also understanding that you're not yourself when you are in pain. And so I try not to take it personal with the things that people say that I'm caring for, or the things that how I feel, their body language, and how I feel they may be making messages that they're not aware of to me. And I try to keep a level head by telling myself that God has brought us to this moment, and that I'm being prepared, and I'm being used for something that is bigger than me, something that I'm not going to be able to grasp and understand. So in that, and just having that faith and that trust, then I'm allowing myself to be flexible and be whatever that patient needs me to be in that moment, but also being respectful of my own beliefs, and not pressing them on a patient, and allowing them to be who they are, because I know a lot of times as nurses we have communication where we do have to be assertive and tell patients the truth, for their best interest, to have their best interest at heart, regardless of whether they see that or not, and allow them to take that in. But people don't care what you know until they know that you care. So building a relationship with them and allowing them to trust you, and not being aggressive or trying to press anything on them at first can help with that healing process.
I think the reason I wanted to ask that question and get all of your perspectives on it is because for those that are listening that have sickle cell, you do spend a lot of your time with nurses. And I really kind of think it's sometimes important for the patient to realize that nurses are people too.
We're human too.
And that they have to deal with a lot of issues that you're not even aware of. And that coming together to find a good solution for you individually as a patient requires a good relationship with those that are taking care of you, and that relationship should also include some understanding. So recognize, if you're a patient of sickle cell disease, that you're not the only patient that a nurse has seen today with pain or with other issues, and that sometimes that might get to be a little heavy burden for the nurse themselves to bear. So try to be respectful of that is really where I'm going with this, and also to show that nurses are strong people, that they have to look at and watch all of these things. They have to watch the pain, they have to watch the disease, they have to look at the injuries, they have to do all kinds of things that can have an impact on them emotionally. and recognize again that they are people too, so emotions can sometimes get involved.
That's correct.
So that's why I wanted to go there. So thank you all for going there with me. Jenny, I asked you this question when you appeared on our show last October, but I'm going to ask it to you again because I think it's a good discussion point. Treating people for sickle cell pain is sometimes a very complex matter because no two patients are the same. Would you talk about how this fact impacts your ability to treat your patients?
It definitely makes it difficult.
Yes, it does.
Sickle cell pain is a very individual experience, and you can have two patients, both with the same type of sickle cell disease, both with SS, both with SC, and they can have two completely different disease course severities and two completely different ways in which they experience a pain crisis. It's impossible to treat two patients' pain the same way.
Right.
Each pain management plan has to be tailored to each individual person, and that can definitely be complicated, especially if you don't listen to your patients and what they're telling you. I guess maybe it would be easier if there was like a standard cookie cutter way to treat a pain crisis, but there's not. And if you treat every patient the same, then you're doing a disservice to all of your patients. You have to listen to each patient, you have to listen to their family members, and create that individualized pain management plan for each individual patient. And it might differ from the one you just created for someone else in
Could be same
like
age, same sex, same everything.
Exactly.
Same,
you just saw them 5 minutes ago, but
yeah.
the pain management plan might be completely different.
Right.
I think in pediatrics it's always important too to listen to the family, listen to the parents, and have them help determine what an appropriate pain plan would be, because parents are always going to know their kids best. And as soon as the provider stops listening to the parents and just thinks that they know what's best because they're a doctor, then you have a problem.
Right. Right. Thank you for that. That's a good answer. Jade, let's say that Victoria came to you and said that she had just been transferred to the hematology floor and that she was going to now have some adult sickle cell patients. What advice about taking care of sickle cell patients would you give her?
I think some of the advice that I would give to Victoria, since she's sitting across from me, I would tell you that we want to be treated like we're adults. That transition from pediatrics into adulthood is very stressful. I know, because I've just made it, and I still feel like I'm still making it because I'm a young adult. So I would say that, incorporate their autonomy as much as possible and point them in the right direction. We like to know that we know it all as young adults, but we don't. I have to admit, I don't know it all.
This is being recorded.
Man, darn it. So just letting you know that we don't know it all, and just try to be as understanding and allow us the options that not a lot of others share with us. If I wasn't as healthy as I've been, I would not have been pushed to try to have a normal life. There are some people that come from different backgrounds. You don't know what people are telling them and what their beliefs are. So just push them to do as much as they possibly can while they can, and to take heed to just living life to the fullest and not allowing sickle cell to be a crutch for them. I know a lot of people that have given up the hope of working a full-time job and having a family and operating as they see other adults without don't have to deal with sickle cell do, and they don't think that they'll be able to do so themselves. So encourage and instill that hope, and pray for their desire to grow and to function at the highest level they possibly can.
And Jenny, although you usually take care of younger sickle cell patients, is there anything you'd like to add in advice to Victoria? That anything you would like to add to what Jay just said?
I guess I'll go back to the point that I made before, that you just always need to listen to your patient and definitely listen to their families and bring them into the care making, the decision making process. You have to know what works for each individual patient best when treating their sickle cell disease. We were talking about this before off the air, but it's always important to remember that when you're assessing pain, it's very subjective. There's not a number that you can use, like there's not a lab test, there's not a vital sign that you can use to determine what level of pain someone is in. Pain is always what the patient says it is, and I think that's one thing that they always stress in nursing school. The pain is what the patient says that it is.
I don't know do they stress that in medical school too, because I've heard a lot of people say that the doctors look at your lab results and say, hey, your hemoglobin is 10, so I don't think you're in pain. I've heard that kind of thing a lot.
I've heard that a lot.
Yeah, and you think, okay, so they're not doing what you just said.
Yeah.
Yeah, it needs to be what you just said.
Well, and you can have a patient sitting in bed watching TV, laying there quietly, their vital signs are normal, and they're having 10 out of 10 pain because they watch TV in order to distract themselves from the pain that they're having.
Right.
Maybe they're laying there quietly because they're doing some meditation, some deep breathing exercises. They're trying to keep themselves calm. So you have to believe a patient when they say that they're in pain.
Now, talking to the patient, listening to the patient, you've said that several times, it's extremely important. Sometimes, though, it may not be easy because they're in too much pain to communicate with you. What happens then?
Then you work as best as you can, quickly as you can, to get them appropriate pain medication.
Okay.
So that they can start to help you make decisions, help you in treating their pain.
Okay. Thank you. We're going to take another break, and when we return, we will continue our discussion about the nursing perspectives of sickle cell disease.
Mass Therapeutics is leading the way in developing treatments for sickle cell disease. We're proud to sponsor the Martin Center Sickle Cell Initiative in its mission to provide leadership, education, and support services to the sickle cell community.
Welcome back to the Sickle Cell Action Network. The Sickle Cell Action Network show is sponsored by Mass Therapeutics, a publicly traded biopharmaceutical company headquartered in San Diego, California. MAST is currently leveraging the molecular adhesion and sealant technology platform derived from over 2 decades of clinical, non-clinical, and manufacturing experience with purified and non-purified polaximers. MAST has developed a drug called MST-188 as a candidate for serious or life-threatening diseases with significant unmet needs. Among those needs is the treatment of sickle cell disease. MAST has enrolled sickle cell patients in a clinical trial known as EPIC. EPIC stands for Evaluation of Purified Polaximer in Crisis. If successful, EPIC could result in the first treatment of its kind to treat sickle cell disease patients while they are in crisis. The EPIC study aims to determine whether MST-188 can shorten the duration of a painful crisis. MST-188 is an investigational drug that has not been approved for commercial sale in any jurisdiction for any use. MST-188 potentially improves oxygen delivery, and it may help keep blood vessels from becoming blocked and more obstructed. It may improve blood flow by stopping cells from grouping together. It also may reduce inflammation and may restore cell membranes and give damaged cells time to heal. EPIC participants continue to receive their normal pain treatments during crisis, and their participation is free of charge to them. The patients involved in the EPIC study may not only be helping themselves, but they might also be helping future generations of those yet to be born. If you're interested in learning more about Mass Therapeutics and the EPIC study, please visit www.theepicstudy.com. Thank you to Mass Therapeutics for sponsorship of the Sickle Cell Action Network Internet Radio Show. Picking up where we left off with Victoria Davis, Jade Parker, and Jenny Carriger, 3 nurses that care for people every day. Thank you all for caring for people. By the way, I don't think I did that yet, so thank you for that. And I'm coming back to Jenny. No, actually, I'm coming to you, Victoria. I'm going to tell you about a web post that I read. It's the American Nurses Association had a web post that said it was called 4 Healthcare Trends That Will Affect American Nurses. And what it said was care coordination has long been a part of a nurse's job description, but with the overhaul of the nation's healthcare system fully underway, a nurse's role in overseeing patient care is only going to increase. I'm going to ask if you agree with that statement. If so, why? Have you seen this taking place?
I will agree with it to a certain extent. I currently work in the emergency room now as a case manager, and patient accountability was not part of that topic that I see in regards to the web post that you mentioned. We as nurses can do all the coordination of care for these patients, but if they are not willing participants in their own care, it's not going to help at all. So I think that yes, nurses can help facilitate those things that patients needs, but it's also patients are held accountable also for their own care.
Okay, and same question to you, Jenny. Do you agree that the nurse's role in overseeing patient care is increasing, and if so, why do you think so?
Most definitely.
Most definitely.
Yeah, I think that nurses play a vital role in healthcare.
Yeah.
Not only are they the eyes and ears for doctors, but I mean they are, if you're talking about a bedside nurse, that bedside nurse is the one person on the healthcare team that is with that patient
The most.
Yeah, exactly. They see the most, they do the most, they are in the best position to know what that patient really needs. So I think it's going to fall more heavily on nurses to perform really accurate assessments, to be able to relay that information back to physicians. I think that there are going to be less doctors hired, more nurses hired in the future. I think also that we're going to start seeing a lot more nurse practitioner run care centers, urgent care centers, primary care centers, where maybe you have one physician to 5 or 6 nurse practitioners, and they will really be the ones that are seeing the patients.
Jade, what do you think? Do you see this happening too?
I definitely do. I don't remember too many doctors waving me out of the door on my way out. So that preparation, that education came from the nurses, and I'm seeing that firsthand where I work at. The nurses, yeah, just to piggyback off what Jenny said, we are the backbone. I do say that confidently because we are the ones that make the difference. We're the middleman. We're the end all. Well, we're not the be all, but
and sometimes you're the advocate too.
Yeah. So we have to be a jack of all trades and incorporate all those other disciplines and make sure that that patient is getting all the information, all the necessary resources to get back to a level where they can function their best. So
okay.
I definitely agree.
So Victoria, nurses spend a lot more time with patients than doctors do, as you all have said. And that makes, I think, the role of the nurse extremely important, as we all agree. But let's talk now about the relationship that nurses and doctors have. How would you describe that relationship?
Overall, I would say that nurses and doctors' relationship is good. The communication, it's good as well, but it can also be worked on. But doctors, they do respect nurses. Things that's going on with the patient, they do respect what they're informing them about. So overall, I do think that both the doctors and nurses relationships are good, because you got to have those two
yes.
parties in order to be able to take care of your patient.
Yes.
So it's important.
And so sometimes, like we just touched on, advocacy as a nurse.
Correct.
Advocacy implies that you may have to try to persuade a doctor to do something that they weren't going to do
Correct.
originally.
That's true.
Right?
That's true.
So how does that work?
Or I really wouldn't say persuade, just more of being more advocating for the patient. This is what the patient is telling me. I know you say you was going to do this, but they indicated that this is what works best for them. Just kind of just giving them more to helping them really understand on what's the best treatment plan for this patient. Doctors, they respect the nurses. They do. They really do. Because we're the main ones that's at the bedside with these patients.
Right. Okay, same question for you, Jenny. How would you describe the nurse-doctor relationship?
Well, I would like to think that doctors respect the nurses. I don't think that's always true. I think I've been in healthcare for 10 years, and I've definitely run across quite a few doctors, unfortunately, during my time as a nurse, who didn't have that respect for nurses. And felt that they were beneath them, and that gets very frustrating as a nurse.
I'm sure it does.
Especially when you feel like you have a different perspective of a patient, and simply because of the credentialing or the education that somebody received, that they think that they somehow know what's better for that patient. But you're standing next to that patient for 8 hours a day, and you are listening to them, and you're hearing them, and you're hearing what they are telling you, you're hearing what the families are saying, and the doctor simply won't listen. Because you're a nurse. You're not a doctor. So
I agree with that as well.
It does happen, yeah.
I definitely wish always that doctor-nurse relationship was one of mutual respect. Unfortunately,
I'm going to come back and give you a chance to say that.
Yeah.
Jade, what about you? How do you describe the nurse-doctor relationship?
I view it as a team. We all share the common interest of really putting the patient as a top priority and doing what's best for them. So I know that as a nurse, I am able to see more closely the results of the medications that they're taking and how they feel, how they appear to be doing versus what's on their chart and what's in their file and what has been the norm that a doctor has read or gotten information about from another physician's progress notes. And so I like to think that we are a team, and that doesn't happen always, being a nurse. So it takes a little bit of assertiveness and meeting a doctor where they are sometimes to let them know, hey, I know this patient. And I think doctors should also understand that we all have licensure and credentials that are at stake, and no one wants to realistically do something that they could be at fault for that would be not in the patient's best interest. So it isn't a thing of, I'm going to put this on a doctor and they'll be ultimately responsible because they're an ordering provider. It deals with everyone, and then I think more so with us because we are the last stop, that last check before an intervention is given or completed with the patient. So
all right. Well,
has to be checks and balances.
So let me take it in a different direction then. If I granted each of you one wish for something that could improve the way doctors and nurses interact, what would that be? Victoria?
I would say communication can be improved, especially if you have a patient who's being seen by multiple specialists. Those specialists do not necessarily always come to the nurse to let them know, hey, I've been in so-and-so room, this is the plan.
Okay.
We don't get that. If it's a primary provider that's taking care of the patient, that does seem to majority of times happen, but the specialist just connecting with the nurse, regardless if it's residents that's coming in the room and seeing this patient doing their assessment, just reach back out to the primary nurse and just let them know, because we see so many providers going in patient's room and we don't know who's who. No one's coming to tell us anything until we see orders on the chart.
Interesting. Okay. Jenny? What would your one wish be to improve the relationship?
My one wish, honestly, would just be to ask that all doctors treat nurses and nurse practitioners with the respect that they deserve.
Okay.
That would be my wish. Even though we didn't go to medical school, nurses and nurse practitioners are an extremely vital part of that healthcare team.
Oh, absolutely.
It kind of goes back, I like what you said earlier, Jade, about don't care what you know until I know that you care.
Mm-hmm.
Sometimes I think doctors get so in their heads that they don't know that they're not showing that they care.
Mm-hmm.
And I think that that's one area where nurses and nurse practitioners excel, is that they are really able to show patients that they do care.
Uh-huh.
So that kind of plays on that as well.
Good answer, Jade. What's your one wish?
My one wish, I think it would umbrella over both what have Victoria and what Jenny have said. Just that humanity factor.
Mm-hmm.
Just that realizing before these letters and numbers or whatever you have gained through your hard work, knowing that these things that you acquire in life, these material things, they don't amount to anything in the long run. They don't, well, not that they don't amount to anything, because you use what you have and what you've gained to help, and so that you can give those things and be of service to others in the capacity which you've learned them in, but realizing that they don't make a person. I was a person before I was a registered nurse.
Mm-hmm.
I was a person before I graduated from college, and I had 2 degrees. And so I have to have a sense of humility about myself and realize at the end of the day that not everyone is afforded the same opportunities that I have.
Mm-hmm.
Not everyone knows the things that I know, and that I don't know everything.
Mm-hmm.
Despite what I do know, the more I know, the more I know that I don't know anything. There's so much more in this world that I could know and understand.
Right.
So having that perspective and being optimistic and knowing at the end of the day, I am a human and I am flawed, but we are a team, and more heads together, we can come up with a better solution to take care and service people.
All right, so I'm going to change this question. I liked your answers so much. We're going to give you another opportunity. If I was to give you another wish, and that wish would be for you to tell me, how would you use that wish to improve the patient-nurse relationship? Victoria.
I would say that don't expect a nurse to know everything, because as nurses, we can be educated by patients. Sometimes people come into the hospital expecting the nurses and the physicians to know everything about their illness, and we don't. I would say, as far as the patient educating the nurses, that's okay. We can learn from anybody, and also for the nurse to go out and learn, be knowledgeable about that illness that patient has. So that will really help improve the nurse-patient relationship.
Good example of sickle cell disease. So many
correct.
doctors and nurses don't really know how to treat sickle cell disease.
Correct.
And they can learn a lot just from listening to the patients.
Correct.
What about you, Jenny? What would you do to improve the nurse-patient relationship?
I guess I would just wish that all nurses would be able to believe their patients when they tell the nurse that they're in pain. Working inpatient as a pediatric nurse and working as a nurse practitioner taking care of kids with sickle cell, I've heard a lot of nurses say that they think a patient might be faking their pain or exaggerating their pain, and that's really difficult to hear. That starts this process of patients and families not trusting the medical community, not trusting their healthcare providers. Then they're going to feel like they're not being heard when they're experiencing their pain. So then they won't seek care potentially when they need to.
Mm-hmm.
So I would just wish that nurses would open their ears, open their hearts, and listen to what their patients are saying.
And you, Jade, what would you wish for?
I would wish for, because I don't have control over a patient, I only have control over myself. And realizing in this day and age, if you want change, you have to be the change that you wish to seek. And so starting with myself, I would want to eliminate my personal biases and my personal experience, in a sense, the negative biases and
Right.
whatnot. I have to understand that regardless of what a person has done to place themselves in my care, whether it was something that they've done at their own hand or something that wasn't, just understanding that they're here, and it's time to find a solution. Don't go pointing fingers, don't go passing judgment, because that can lead to time wasted, and we don't have any time to waste, especially with sickle cell.
Right.
There's no time to waste. So getting rid of any of the negative factors that would impede me doing what's right for a patient and helping them. I think that's what I would want to do to enhance and make the nurse-patient relationship more positive.
Thank you all. We've come to a period where we are just about out of time. I guess I'm going to ask if you can give me a brief answer on this. Any general advice for any sickle cell patients that might be listening today, Victoria?
I would say to always continue to learn about your illness, to also always advocate for yourself, and to always speak as far as letting the providers know how you're feeling. Don't downplay your pain just because you don't want to be labeled. Just let them know exactly how you're feeling.
Good advice. Very good advice. Jade, what about you? Any advice for sickle cell patients?
The patient in me would say stay hopeful and strong and prayerful that things are going to progress and that things are changing. There's so many things that are being developed and under research right now that will help us. I'm sure. I'm not going to say may, because I know they will.
Right.
The nurse in me tells them to be compliant,
Okay.
to actively participate in your care.
Mm-hmm.
We can want what we want for you, but if you don't want our help, we can't be helpful. We can't assist you. So be compliant and learn and educate and share with others what it means to you to deal with this.
Thank you so much. And that compliance, that's a very important topic. Maybe we need to deal with that a little bit more in a future show. And Jenny, since you're the one who is actually actively taking care of sickle cell patients, you get the last word. What would you like to share, any advice with sickle cell patients listening today?
I guess this is more to the providers and to people who may have a child in their school who is dealing with sickle cell, or sickle cell is deceptive in nature.
Yes.
You can't look at someone, like we said before, you can't look at someone who has sickle cell disease and know that they have it. The damage that's done by sickle cell disease, it's all done behind the scenes.
Yes.
And sometimes it can't even be felt by a patient until irreversible damage has already taken place.
Right.
So I think that sickle cell disease is misunderstood by many people and by many healthcare providers. And I see my patients suffer as a result of that. School personnel, they don't know what sickle cell disease is, and so they don't understand necessarily why their student needs to have a water bottle with them all day, or have frequent bathroom breaks, or frequent rest breaks during gym. They just see them as maybe not wanting to push themselves like other students. And then children with sickle cell disease tend to grow at a slower rate than their peers. So then they end up being on the receiving end of bullying as a result.
Right.
And then I have patients who are 8 and 9 years old who are depressed because of that bullying. ER providers, they might see patients come in with sickle cell disease and label them as drug seeking because they come into the ER in a pain crisis and they're asking for a certain narcotic at a certain dose.
Right.
That doesn't mean that they're drug seeking. It simply means that they're knowledgeable about their disease and their body, and they're advocating for themselves. So treating patients with sickle cell disease, teaching them in your schools, having them in your lives, it means that you're taking care of not only their body, but you're taking care of their mind and spirit as well, which goes back to my initial concept of what nursing means to me. You're taking care of a whole patient, a whole person.
That's a good way to bring us full circle. Thank you, Jenny. That's
You're
a very
welcome.
good way to bring us full circle. And for those of you that may be listening that do have sickle cell, I tell you, you would want Jenny Carricher to be your nurse, because she does get it and she cares. It's time to close the show, and as always, I'll do that with something for you to think about. And today I'm going to use a quote from Francis Bacon, who actually lived in the 16th century, early 17th century. He was an English philosopher, a statesman, a scientist, a jurist, an orator, and an author. He served both as Attorney General and as Lord Chancellor of England. And Francis Bacon said, "If we do not maintain justice, justice will not maintain us. If we do not maintain justice, justice will not maintain us." These days, it's hard to escape hearing the chants and pleas for justice that are sweeping across our nation. The unfortunate series of senseless killings that have transpired over the last few days has many of us feeling anguished, sorrowful, and angry. Watching video recordings of African American men being killed by police officers, or watching a deranged gunman fire on police officers as if they were targets at a state fair shooting gallery, are things that can do that to us. President Obama and other political leaders keep telling us we are better than that. But I have to ask, are we really? I would like to think that we are better than that, but the evidence just doesn't support that view right now. Frankly, I think that it is pathetic that we haven't reached the point of being able to eliminate hate and division from our collective existence. That is really sad to me, and I'm sure it's sad to so many millions of others around the world. But as cops kill people, and as people kill cops, I think we need to ask ourselves one very thought-provoking question. Isn't it a shame that we even need cops at all in our society? Unfortunately, right now it seems that we do. Too bad for us. As we talk about justice for black lives, let us also think about justice in terms of sickle cell disease. Where is the justice for sickle cell? Black men get murdered by the police and our communities get fired up into an uproar. Black men, women, kids, and babies have their lives cut short by sickle cell, and there seems to be nothing but silence. More black men die from sickle cell complications than get killed by the police on any given day, week, or month of the year. Where is the justice in that? The injustice that I'm referring to can be found in the fact that our society has not made sickle cell a priority. It is not important enough to eradicate the disease by finding a cure that can be universally distributed. It is not important enough to ensure that people with sickle cell can find and keep jobs that let them become self-sufficient and contribute to our economies. It is not important enough to ensure that kids have every opportunity to learn and grow into their full potential. After us knowing about this condition for 106 years and counting, I have to ask, where is the justice? Did you know that from 1910, when it was identified, until 1972, the United States government invested only $1 million in sickle cell research? Do you know that even today, sickle cell funding in general falls way behind other diseases that affect fewer people, most of which are diseases that predominantly affect white people? Does that seem just to you? Finding a cure for sickle cell is possibly every bit as difficult as it is to find a solution that makes people love each other rather than hate each other. I know that. But I also know that too many babies are dying before they reach adolescence, and too many adults are being subjected to lives that are full of anguish and dysfunction. For once, I would like to see people rise up and protest about the inequities faced by those living with sickle cell. Yes, Black Lives Matter. They matter because all lives matter, including the lives of people affected by sickle cell disease. Since nobody else is asking for it, let me do it now. Give us justice for sickle cell, and give it to us now. That's our show for today. Please join us again next week.